Textbooks are not usually considered as works of literature or art. They are functional and utilitarian, designed to impart knowledge of a specific area of study to students. While more modern textbooks often incorporate bright colour, amusing images, and so forth, older material was not likely to deviate from a rigid scholastic template. One book which was not like the others was the Dental Student's Technical Course in Rhyme, published in Melbourne in 1909. The subtitle of the work was Tunnock's Textbook of Anatomy, Physiology, Dental Anatomy, Dental Pathology, Therapeutics, Materia Medica, and Pharmacology, written in rhyme so that all the difficult and essential portions can be easily memorized. Or, more commonly and succinctly referred to as Tunnock's Text. The author of this poetical dental textbook was a man named James Tunnock. He was born eldest in a family of 11 at Cape Bridgewater, a locality near Portland, Victoria, in 1853. Tunnock did well at school, and with no interest in becoming a farmer, left home as a young man to go to Melbourne to learn dentistry. He obtained his degree and then went on to Chicago, Illinois, where he graduated in dental surgery and mechanical dentistry at the International University of Chicago. Returning to Australia, he practiced as a dentist in Victoria. In 1884, he married Susan Cecilia Aldridge. Their first daughter, Minnie, died as a baby. 3 other daughters and a son were born over the next 28 years. The family moved to Western Australia in 1895, where they lived in Perth for several years. Tunnock had premises in Wellington Street, Perth, and involved himself in civic matters, being a Mason, and at one time, around 1896, the chairman of the Leederville Local Board of Health. He was also honorary dentist for the Australian Natives Association and the Deaf and Dumb Institution of Perth. In December 1897, he stood for election to the Dental Board, voted on by registered dentists in the state, but of the 7 nominees he came last, with a mere 5 votes out of the 180 cast. The winner received 54 votes. In all, Tunnock must have had a disappointing December, for on the 29th of that month he arrived at his dental parlour to discover a showcase that had been fixed to the exterior wall had been broken off, and 6 sets of false teeth, valued between £50 and £60, had been stolen. On the 6th of August 1898, a fire broke out in 2 shops in Newcastle Street, Leederville. One was a land office owned by the Mayor of Leederville, and the second was owned by Tunnock, who was also a member of the Leederville Council. Both buildings were destroyed. In May 1899, Tunnock relocated to Kalgoorlie, in partnership with another dentist named Cotter, whose premises had also burned down shortly before, in March 1899. Tunnock returned to Victoria in 1900 and established himself in Hopkins Street, Footscray, and Burke Street, Melbourne, and eventually operated the biggest dental practice in Australasia at the time, as well as the International Dental College in Sydney. Tunnock was later described as a brilliant eccentric, always wearing a frock coat and top hat. He maintained a reasonably notable public profile during the early years of the 20th century. In 1902, an Act of the South Australian Parliament regulating dentists, which registered dentists in practice for more than 12 months, but denied the same to dentists with equal or greater qualifications who began practice after November 1901. Tunnock, who was registered in Victoria, New South Wales and Western Australia, wrote letters condemning those dentists who looked after their interests at the cost of their neighbours. Tunnock presided over the inaugural meeting of the Commonwealth Dental Association on the 6th of February 1906 in Sydney. The purpose of this group was to petition for universities to adopt a standard curriculum across the country, and to encourage the universities to adopt higher standards in training new dentists. Secondly, the association wanted cronyism taken out of the registration of dentists. In a letter to the Sydney Morning Herald that March, Tunnock pointed out that some dentists who had completed 4-year diplomas in America were refused registration by the Dental Board, while others with less than a year's training were accepted. Tunnock experimented with anaesthesia during this time. In the winter of 1907, he announced his discovery of a painkiller so effective that patients could extract their own teeth under its influence. On Wednesday morning, 29th of May 1907, at Royal Hall, Footscray, Tunnock was introduced by the Mayor of Footscray to an audience of interested citizens. He gave a brief history of the development of painkillers in dentistry, before claiming that he had found one of the most wonderful and important discoveries in the history of dental science. Whatever his invention was, it allegedly softened the bony walls around the tooth, allowing for painless extraction, according to one newspaper report. It was so effective that patients could pull out their own teeth. Cards were passed out to the audience for those willing to participate in the demonstration, with them invited to write down their problem. Number 7A wanted 7 teeth drawn, number 10 had 2 teeth to remove, and so on. The first person invited onto the stage was Mrs. Taylor of Truganini, who had come 16 miles to seek treatment. She had 3 badly decayed molars. She was injected with the anaesthetic and then handed a pair of forceps and yanked the offending teeth from her own jaw. She said it was easily done and there was no pain or discomfort. Then followed a girl who had some of her teeth removed by a dental apprentice, an elderly man and 2 others, all of whom vouched for the painlessness of the procedure. One of the teeth extracted was said to have long roots and resembled a garden fork. The demonstration was highly successful for Tunnock, with even dental students who had come to observe with some scepticism, admitting his anaesthetic was most effective at dulling pain. Tunnock even wrote a letter to the British King Edward VII, announcing his discovery, and adding that he was now working on a method to prevent tooth decay. In July 1908, when Tunnock gave another demonstration with 40 people pulling their own teeth in Melbourne, it was said that his anaesthetic had been used to extract about 15,000 teeth per month. In 1910, a young woman from Collingwood named Nellie Campbell came forward to claim that Tunnock was the father of her daughter Gwendolyn, who had been born in April, and that she sought maintenance from Tunnock. She said they had first engaged in sex in his waiting room when she was a patient on the 28th of July 1909, and had subsequently met in his surgery. Tunnock denied he had ever been in an intimate situation with Miss Campbell, and charged that she was a blackmailer attempting to ruin him. When the case came to trial on the 2nd of August 1910, Nellie Campbell failed to appear, and also failed to produce the child as she had promised she would do in a preliminary hearing. Even her lawyer, whom she failed to instruct, didn't bother going, and the case was struck out, with 3 guineas costs awarded against her. More trouble flared with the Dental Board in 1913. It was noticed that Tunnock had used the designation Doctor on the nameplate at his Melbourne surgery. Under the rules of the board, Tunnock was not legally allowed to use Doctor before his name. Rather, he could use DDS after his name, as he was qualified by a diploma rather than a degree. Tunnock pled guilty and paid a fine of £5. As in WA, fires broke out in the Burke Street surgery in October 1914 and December 1916, causing minor damage. In 1922, another scandal intruded into the now elderly dentist's life. One of his daughters, Gladys, married a William Anthony Davis in 1916, who it transpired was a bigamist, calling himself Reginald, who had married his first wife Ethel in 1913 and afterwards abandoned. Likewise, he abandoned Gladys in 1917 and in 1918 had married Maria Butler. When the law finally caught up to him, the 29-year-old was sent to jail for 4 years, despite attempting to convince the court that Gladys had enticed him and married him while he was under the influence of drugs. Having moved his premises to Collins Street, Melbourne by 1928, Tunnock found himself once more stalked by fire. A salesgirl in a costumier's accidentally knocked over a spirit lamp. Tunnock attempted to douse the fire, but the flames had sprung up too high, and he retreated and broke the fire alarm to summon the brigade to put it out. Tunnock died in Hamilton, Victoria on the 16th of June 1933, aged 80. J.T. Tunnock is long gone, but his poetical masterwork lives on. Here are some selections from this remarkable tome. Description of a tooth. In describing a tooth in the usual way, crown, neck and fang, we should certainly say. Enamel, dentine and cementum, an ossified lump, with a hollow in centre filled up by the pulp. The pulp is soft tissue, we will observe, supplied with blood vessels as well as nerve. The crown is the part which above the gum shows. The fang is the root, which everyone knows. The neck is that part which lies between the crown and the fang, beneath the gum seen. The intestines. The small intestines are 20 feet long, the upper part thick, vascular and strong, containing many cells, we will find, which are known to be of an absorbent kind. The lower part is thinner, it is clear, less vascular, and fewer cells appear. The duodenum to the pyloric end of stomach is joined, is about 10 inches long, as we will find, receiving the chyme from the stomach, 'tis true, as well as the juice from the pancreas and gallbladder too. The jejunum next section, measuring 7 feet, and the ileum 12 feet too, makes the 20 complete. 4 coats they have, as in the stomach we find, although the inner coat is of a different kind. Morphine. To morphine next on our list we come, the anodyne alkaloid of opium, a powerful anaesthetic we observe, benumbing the tract of sensory nerve, but a drug the dentist usually rejects, owing to its disagreeable after effects. Not even with arsenic to obtund pain will a dentist now use it who has cocaine. Nitrous oxide, protoxide of nitrogen. Nitrous oxide, N2O its formula fix, discovered by Priestley in 1776. In the year 1844, Horace Wells, a dentist, as dental history tells, gave a scientific demonstration of its use in a surgical operation. It is a gas generated, as we may state, from distillation of ammonium nitrate. To the profession known as laughing gas, as a general anaesthetic none can surpass. In dental operation, history is made clear, most successful has been this gas's career. And here is a verse called Putrescent Pulp. Putrescent pulp, which so often is seen, is a destruction brought about by moist gangrene, the result of degeneration by microbic action, causing fermentation and putrefaction. The first step in this operation should be to clean out the debris from the tooth cavity, then wash with a diffusing antiseptic, which will readily pass, and destroy all the microbes in this putrefied mass. As a germicidal antiseptic, formalin, we find, for this particular purpose is well designed. If sealed in the cavity 24 hours or so, few of the organisms are left living, we know. When the chamber is cleansed and the canals syringed, the introduction of a filling may then be arranged. This one's called green stain on children's teeth. The green stain on children's teeth, which often we see, is no form of calculus, authorities agree. It is a parasitic growth of mucus formation, collecting on tooth as a green discoloration. Paint this with iodine by way of a start. It acts as a solvent and softens the part. Then when scalers and pumice are brought into play, like the calculi, we can soon get it away.